Hi everyone, Ian Harvey here, massage therapist. Today we're going to be talking about therapist thumb, self-care for painful thumb joints or just a painful thumb. This is something that seems to happen to just about every massage therapist, myself included. I want you to start thinking about this painful thumb in a new way. This isn't just your new life. I'm a massage therapist, my thumb has to hurt. No, this is an injury. If you've got either acute or chronic pain in this thumb, that's an injury. If a client came in with something like this, you would want to treat it and you would want them to change their activities. That's what I want for you. I want you thinking about this in a new way, and I want you treating yourself a little bit differently. Treat yourself how you want your clients to treat themselves. Now, before we move on, let's talk a little about the anatomy at play here. We've got two joints that are the usual suspects here. We've got the carpometacarpal joint here. This is an extremely mobile joint. It allows us to do this circumduction trick. It allows us to do this opposition trick. A very mobile joint. It's surrounded by powerful muscle, but it's also somewhat prone to injury. We've also got this metacarpophalangeal joint right here. This joint is just a simple hinge joint. It's not like these other metacarpophalangeal joints because it only has movement in this one plane. This one is also prone to injury, especially when you're doing pincer type movements. More on that later. We've got a bunch of thumb muscles to think about. We've got intrinsic thumb muscles, which are around this big wad of meat right here, this thenar eminence. They run between the thumb and the rest of the hand. And we've got extrinsic thumb muscles that don't live in the hand itself, but their tendons insert in the thumb, and those live in the forearm. Now, if this is new pain, or if it's sudden onset, or if resting doesn't make it better, go see a doctor about this. This might not be related to overuse. But if this is something that you're familiar with, it's something that keeps coming back, you've had it checked out, then there's definitely things that we can do to treat it in 3 phases. If you want to skip to one of the phases, just look down in the description. You'll see little time codes that you can click on. Phase 1 is the thumb vacation. This is when you stop using your thumb for massage. I know, it's a terrible thought. What am I going to do without my thumbs? Well, there's a lot of stuff that you can do. And if you're able to take your thumb out of the massage game for a while, then it can start to recuperate. It can start to get the rest it needs to make the repairs that it needs to reduce that central nervous system hypersensitivity that it's developed, so that you can start reintroducing it, which we'll do in phase 3. But for this thumb vacation, take your thumb out of the picture. It's going to mean using more open fist, more knuckles, elbow tip and forearm, and reinforced palm. And it's also going to mean changing the way that you do petrissage. If you're used to doing petrissage with kind of a pincer grip, well, first of all, it's time to change to flat fingers. I find that a flat duck grip is more useful anyway. We'll talk about that more in the reintroduction section. But also, taking that thumb out of the equation, boop, your petrissage is going to look like this for a while. The thumb ain't doing nothing. The thumb is sitting this one out. Now, this won't work for every application, but this is going to mean being creative. If you'd like some ideas for some thumbless alternatives, I'm going to be writing about that on my blog in the future, so keep an eye out for that. The next part of this thumb vacation is going to be taking care of this inflammation. So for the next week, 2 weeks, every day you should be icing and wrapping. Some people aren't so big on ice, they prefer heat. Ice is what I found to be most useful for this particular injury. And there are 3 ways that I like to ice. First of all is just taking an ice pack, like you would get from a corner drugstore, wrap it in a piece of cloth. Yes, I own handkerchiefs. And sandwich it around the web of your hand. Chill out that way for about 10 minutes. Do this about twice a day. The second way, which is slightly more trouble, is ice massage. Take a piece of ice from your freezer, wrap it in a paper towel, and you're going to be doing just a gentle massage around the relevant thumb joints, and then wiping that water off with the paper towel. Ice massage, along with this wiping, gets the area very cold very quickly. Once it becomes numb, move it around a bit, regain that feeling in your hand, and then continue. Do this for about 10 minutes, at least once a day. Your third option is total immersion of the entire hand in ice water. Refreshing. Hold your hand in the water, move it around very subtly. Your hand is going to go numb very quickly. Leave this in here for about a minute. Remove, dry this off, regain some of that feeling, and then plunge it back in. Continue doing this for about 5 minutes or until you can't stand it anymore. Remember, don't let it stay numb for too long. And then dry this off and try not to hate me. Now you can do a combination of the three. When I've got an injury, I'll use an ice pack twice a day and one of the other methods once a day. So just experiment. When I'm on this thumb vacation, I also like to keep my thumb wrapped for at least 4 hours a day when I'm not working. That means getting an ace bandage. Pin this bandage in place, wrap it once around your metacarpophalangeal joint, and then just do a few revolutions around your hand and your thumb that encompass all of the joints, all of the intrinsic muscles, and just a little bit down your forearm to compress the tendons of the extrinsic muscles as well. It should end up looking a little something like this. Your hand won't be useful for much, but it'll still have some movement to it. And once you've got this going, just keep it like that for the next 4 to 6 hours. Don't sleep in this unless a doctor tells you to, because you are reducing the blood supply just a bit. If you start to go numb anywhere, then this is too tight. Now the second phase after your thumb vacation is self-massage and stretching. You'll notice that I haven't been having you do self-massage for this entire first 2 weeks or 3 weeks that you've just been resting. And that's because we don't massage ourselves in the way that we massage our clients. When this thumb is in a very painful place, we don't treat it the way we would treat a client's thumb. We start mashing on it, we find trigger points, and we start digging in. And that isn't how we would treat a client. With a client, we would do a slow warm-up, we would be gentle, we would take their comfort level in mind, versus if it's us, screw you, hand. No, be nice to your thumb. So after about 2 or 3 weeks of rest and the thumb has calmed down considerably, we're going to start doing a little bit of self-massage with some stretching and movement. We're going to come at this from a myofascial perspective. So we're not going to be trying to work with trigger points or anything like that. We're just going to be grabbing some fascia and then moving the thumb. So the first technique is going to look like this. We're going to, using our thumb, we're going to compress this region between the first and second digits. Be very gentle with this. You want to feel this, but you don't want it to be painful. And then we're going to introduce some movement. So take that thumb through circumduction. This part should last 10 to 15 seconds. Then we're going to grab this meat on the palmar surface. So like this. You might be able to grab a lot of muscle, you might just be able to grab skin, that's fine too. Again, go through that gentle range of motion. And finally, we're going to start using that thumbless duck grip to scoop up big pieces of forearm, and then again take that thumb through its gentle range of motion. Now we're working on the extrinsic thumb muscles. If you follow this radius all the way down, you're going to hit the flexor here, and you're going to hit all these extensors and abductors up here. So gentle range of motion. Make sure to go in both directions with this. This entire self-massage should take no more than about a minute, and you should do it about twice a day. Just don't overdo this. It's very easy to overdo the self-massage. And finally, phase 3, which is going to be strengthening and reintroduction of the thumbs to your practice. Thumb vacation is over, but gradually. So for strengthening, I like to use this putty stuff, and you can use, other stuff that you can find at any fitness place. You can get this putty stuff from Amazon. Just look for therapy putty. Start gently with this. Start with less strenuous activity and then move toward really going for it. So, for that first week, maybe it's been 3 weeks since you recognized that you were injured, you start with this strengthening. And that's going to mean doing these grasping exercises, using your thumb to compress putty against your other fingers, and going at this until your hand fatigues. And then do some hand stretches. If you'd like to see some sample hand stretches, I've got a video on my other channel that you can check out. Click in the corner there. So once you have fatigued this hand and done some stretches, go to the other hand. Fatigue it, do some stretches, then you're done. Consider icing afterward. You can add a second set after you've been doing this for about a week. Now for the reintroduction of your thumb into your practice, we're going to talk more about this in future videos. Pay attention to your pain. If something's painful, stop doing it. If your hand or your thumb muscles start to fatigue, switch to something else for a while. If you're constantly switching from tool to tool as you fatigue, you're going to have less injury. And use your thumb in ways that are friendlier to these two joints here. If you do this duck grip, where you're using flat thumb and flat fingers and drawing this tissue up, that's a lot friendlier to these two joints than if you're doing this pincer grip. Pincer grip's still fun. Pincer grip's still cool. Just realize that it can put a lot of pressure on your thumb, especially if you're using it dynamically. Use your thumb in a way that you can do a push-up on it. So if you're applying pressure with your thumb, use straight joints versus this kind of thing. If you're doing these moves, these are very stressful for the thumb. Only use your thumbs in ways that you could press down with all of your weight, even if you're not using that much weight. And finally, when you're using your thumb to make these C shapes with your hands, maybe you're doing a strip down the forearm, make the shape first and then apply it. If instead you're moving this thumb during that move application, during that stripping, that's putting a lot of extra stress versus creating this shape and then applying it. Let most of the motion come from your elbow, come from your shoulder, come from your wrist. Okay guys, let me know what you think. Let me know if you have any tips of your own. Consider subscribing, and I'll see you next time.